Hello, everyone. I'm Traci Arieli, end of life doula and founder of Comforting Closure. Welcome to another episode. At some point, most of us are going to deal with medical bills. And for many families, those bills are not small. The problem is, most people assume that when the bill arrives, that number's final. They think this is what I owe, and now I have to figure out how to pay for it. But when someone is seriously ill, caregiving, or nearing the end of life, there is very little time, energy, or mental space left to raise concerns. The bills come in, the paperwork piles up, and financial stress gets layered right on top of everything else. So, what options do families actually have? What help exists that people are missing? And what should you know before you start draining savings, putting bills on credit cards, or assuming there is no way out? Today, we're going to talk about what happens behind the scenes with hospital bills, financial assistance, and the programs that many patients never hear about. I'm joined by Jared Walker, founder of $4, a nonprofit that helps patients reduce or even eliminate medical debt by helping them access hospital financial assistance programs that they may not know they qualify for. So grab a warm drink, find a comfortable seat, and join us for the conversation. Jared, welcome, and thank you so much for being here today.
Thank you so much for having me. Really, really appreciate it.
So let's start with you. Tell us about your journey to starting $4.
Yeah, so I am in Portland, Oregon. So grew up in Portland, and I really had no intention or ideas of starting a nonprofit. This all started in 2012. My wife and I were sitting at home. She got a phone call. Her aunt had passed away from cancer, and then a couple minutes later, I got a phone call. My cousin had gone into labor, 7 weeks premature. Baby needed a heart surgery to live, and it was like same day, same hour. These medical emergencies happened within our families, and I remember one of the big conversations was how much is it going to cost? How are we going to pay for it? All of that, and I was pretty young at the time, and this was my first time seeing the US healthcare system do its thing to people, and realizing when you have a medical emergency, a lot of times you're just faced with this financial burden, and I wanted to help people in that situation. So $4 originally was dollar for Portland. And the idea was to have a crowdfunding platform in Portland to help people pay medical bills. So I would run around in Portland and do, small grassroots community organizing, coffee shops, breweries, music venues. And every month I would pool the money together and pay hospital bills for people. So that is how it all started. It has changed over the years, and happy to chat more about that. But that is kind of what sparked the idea, and kind of what made me see the need.
Well, it's interesting. So when did it go from just doing charity care to realizing that hospitals, that they have funds that they're supposed to be helping people with?
Yeah, so that was a few years later. So I officially launched Dollar for Portland in 2015, and I spent about 5 years of running this organization and helping people, every month paying hospital bills. And then I met Eli, who is now our general counsel and director of policy at Dollar for. But he asked if I'd ever heard of charity care programs, hospital financial assistance, and I had never heard of it. He, goes on to tell me about Section 501R of the Affordable Care Act, and kind of getting all nerdy on me and telling me all the different stuff about it. And it sounded too good to be true for me. But at the same time, I kind of had this moment of if it is true, I just spent 5 years of my life paying hospital bills for people that would have been eligible for these programs, right? So I started looking into it, and that was kind of I guess it re inspired me or made me really angry at the system again. And I started helping patients through the financial assistance paperwork because I started getting into it and being like, oh my gosh, like none of these patients I've helped have ever heard of these programs. I've never heard of these programs. The hospitals like don't have the applications on their website. You have to fax them back to them. It just was like this really complicated process. So I started, getting familiar with financial assistance policies and applications. And in a few months, I got like $1 million of medical debt to disappear for people, simply by helping them, one, telling them that the program exists and then helping them through the paperwork. So that is when it shifted. It was 2020 is when it was more than Dollar for Portland. It wasn't crowdfunding. It was actually like more patient advocacy. So that was like the big shift in Dollar for.
I coming from where I come from, I see people making decisions, unfortunately, based on money.
Mhm.
And I'm sure you see it every day, the financial problems that people have and how that causes them to make health decisions that are against their best interests.
Mhm. Yeah, I mean, it's what is it? What 1 in 4 Americans will just neglect care that they need.
Yeah.
They just won't even get the care because of the cost. And we see that all the time where people say, "Oh my gosh, like, you know, I finally feel like I can go see a doctor or go to the hospital because of this program. I had no idea." So it's definitely, and it goes far beyond that. It's people that aren't taking the medications that they need because the medications are too expensive, or taking half the medications, or yeah, like you said, we see it all the time.
Now, caregivers are often the one opening the bills and making calls and trying to figure it all out while their loved one is sick, right? What do you see them going through? Because I'm sure you work very closely with families.
Yeah, I think Dollar for we have a platform where people can go. So basically, what had happened with Dollar for is, once I discovered charity care and wanted to kind of spread the word. It was actually thanks to social media where we kind of exploded in 2021. But that was like, we wanted to create a platform that people can access any financial assistance policy in the country. And
Mm.
a lot of times we would have people that were like trying to apply, but it was like, hey, I'm not the patient. I'm helping my mom, or I'm helping my dad. Like, what do I do? So we had to really think through how our our system can support all of these people, to make sure that we can get people to apply and it goes through and it's not confusing. So we see that all the time where people, yeah, it's a family member. I mean, I've filled out this paperwork multiple times for my own parents, and my own family members. So it can be really confusing, and I think that that's kind of universal, depending whether you're the patient or you're a family member. Like, it's just jumping through these hoops of like, okay, they want 3 months of pay stubs, and they want tax returns, and they want this, and they want that, and it's like just trying to, and it's like you're trying to also recover from a surgery, or you're going through chemo, or you're like, you're in the middle of a medical crisis, and now you have all of this paperwork and stuff to fill out. So trying to make that easy across the board is challenging.
And people don't realize, even in the best of times when you're healthy, because I've gone through many surgeries from like 20 to 40. I had health issues and I had a full-time job. And
Hmm.
this was my second part-time job, I would say, because it'd be a whole bunch of spreadsheets, calls. I mean, our health system makes it so difficult just to survive.
Yeah.
Let alone thrive. It's really unfortunate. Um, Now, I know most people assume that when they get a bill, especially the way I think many of us have been conditioned, pay that bill. Just pay the bill. You don't want your credit to be hurt. Just pay the bill. Um, what should people be doing when they C-bill and they see how much they owe, like what's the first thing they should be really looking at?
I always tell people, take a deep breath. You have more time than you think. I have I have a bunch of medical bills in front of me right now that say final notice, final notice, final notice. Medical bills cannot really negatively impact you until they go a year without any payment. So that's like number one. And now it can negatively impact you in, because it can cause stress, right? Like, you get these bills, final notice, like, but it's not the final notice, right? They have a system where they are going to pressure you to try to pay it. And yeah, like you said, put it on a credit card to, do these things that are not in your best interest. So the first thing is you have a year. You have a year until it will negatively impact your credit score. And in that time, the first thing I tell people is check to see if you are eligible for financial assistance. Like, number one, see if the hospital that you went to, almost every single hospital in the United States has a financial assistance or charity care program. Dollar for has created a database of every hospital in the country. All of the charity care policy data, you can see if you are eligible in a few seconds. Just put in your household size, your income, what hospital, it tells you if you're eligible. And then you can fill out the paperwork. But number one is like see if the bill can just be waived or discounted right off the bat through these programs. And then I would say step two, if you're not eligible, let's say your income is too high or the bill is too old or whatever it may be, that's when you want to ask for an itemized bill. You want to see, they say, and I'm sure, there's so many like TikTok videos and Instagram videos of people saying, okay, this is what you do. 80%, they say 80% of medical bills have errors in them, which is alarming, right? But we see it all the time. It's like, oh, hey, you were double charged for this, or it's like we've all heard of the $50 aspirin or the $100 Band-Aid or whatever, and sometimes just asking for an itemized bill can reduce the bill. So then, okay, let's say you get the bill, you want to check to see. One, I've had a lot of people talk about how they're using Chat GPT or Claude or something, putting it in and saying, hey, check this. And there are tools. The problem right now, I would say, is that there's a million of these tools popping up now. We negotiate medical bills. We do this. It's hard to I'm still trying to get a good, trying to figure out the landscape of this, because sometimes people charge a ton of money to do this. It's like I don't have like a great recommendation for a tool. I know that there's like Healthcare Blue Book but again, you can use the AI tools out there to check the accuracy of the bill. And then let's say that you are not eligible for charity care. Your bill is perfect. There's no errors. At that point, I tell people to negotiate. I know that this is like, maybe it's just really intimidating for people, or maybe people don't know that it's possible, but you can negotiate your medical bills. Absolutely. I have done this time and time and time again, and I'm happy to go into more detail on that. But you can absolutely negotiate your hospital bills and medical bills. I always tell people, ask for what is the settlement amount. That is like the magic words. Like, hey, if I pay this today, what will you take off? They at the very least, usually I can get 30-40% off the bill just by asking that question, if you can pay that day. So anyways, I'm just rambling at this point.
No,
But
this is very interesting. I mean, this is what people need to know. I think that there's such a mystery behind doing this. I mean, people feel funny, especially in our culture, negotiating.
Yeah.
Really feel funny about just every, negotiating anywhere. And we don't know. And especially when it has to deal with our medical care, where we almost put these people on a higher level, right? Like um, that they're the people of authority. So who are
Mhm,
we to question, right? Um, or we don't want to cause waves.
mhm, mhm.
So this information is really important for people to know.
It is it's shocking. I started doing this for patients. So when I was doing the crowdfunding piece in Portland, I would raise like $5,000 for these families each month. And sometimes they would have bills that were, seven, $8,000. And I would try to see like, can I get it paid? And almost every single time I could negotiate it down because I had the money. So here's the catch with negotiating is you can't normally you can't negotiate a lower rate and then ask to be put on a payment plan for that lower rate. If you negotiate the price, you got to have the cash. So if you have $1,000 bill, I would say offer half. See if they will take half up front, and then maybe they'll take, $600, $700, whatever. But most of the time, just asking, hey, is there a settlement amount if I close this out? I just had a $1,300 lab bill. It was just like basic lab work. And I called, asked, hey, I would like to close this out. Is there a settlement amount? They took it down to like $350.
Wow.
Um, and it's just, and this can be done, I don't think that this will work for your local dentist office or your local like chiropractor, right? But if it's a um yeah, hospital, any of the groups within the hospital, the labs, the X-ray imaging, all of that, like I absolutely negotiate these. We even have scripts on our website if people want to
That's
check it out
great.
because it can be intimidating, and there's a lot of really good financial literacy creators and stuff that have put out videos. I even have some on our channels of me negotiating hospital bills live. I just recorded the call. So there are resources out there. It can be intimidating. It does feel weird, but it can save you money.
Now, when you say charity care, what who is that really meant for? I think people have a vision in their mind, especially when you say charity, right?
Yeah, great question. So many people just disqualify themselves
Yeah,
for these programs because they're like, "Oh, that's not for me." I didn't qualify for Medicaid, or I didn't qualify for food stamps, so like I won't qualify for this. These programs in these hospitals. So first, like let's just set the stage. 65% of hospitals in America are nonprofit. They are tax exempt. So, in exchange for that tax exempt status, they have to have charity care programs. So, these are programs that will reduce or sometimes even eliminate your hospital bills if you meet certain income requirements. So, this is how the hospitals keep their tax exempt status, which is very important to them,
mhm.
right? So you don't need to feel bad about getting charity care. You don't need to think, oh, if I get charity care, so and so won't get charity care. That is not how it works. Like this is not a pile of money that runs dry at the end of the year. It is if you are the hospital has done the math. They know how much charity care they can give, and they are writing it off because they get tremendous tax benefits. So there's no shame in it. What I would say from an income perspective is on average, if you are a family of four and you make under $100,000 a year, you are most likely eligible for something. It might not be 100% discount, um, but most hospitals will structure their policy like here in the Pacific Northwest, in like Oregon and Washington, every hospital will waive 100% of your hospital bill if you are at or below 300% of the federal poverty guidelines. And then they have a sliding scale discount up to 400%. But if you're in rural Nebraska, it's probably going to be lower. If you're in New York City, it's going to be higher, right? It's like all based off of cost of living and all of that. So it's not standardized across the country, which is why we built that tool on our website so that people can see, am I eligible at my hospital?
And so people don't have to be at zero to qualify. I think people feel like they have to lose everything before that happens.
Yeah, definitely not. I mean, it really is. I tell people all the time, I'm like, it's more generous than you think. And then there are like special circumstances. So let's say, they usually have something called like a financial hardship policy where let's say that your income's pretty high. Um, but if your bill exceeds a certain percentage of your income, then they have a special policy for that. So like, okay, let's say I make $100,000 and I'm a single person. Well, that's pretty high income. But if I get $100,000 hospital bill, they have a program, right? So
Yeah.
they have yeah, again, I just tell people like it only takes a couple seconds to see if you're eligible. Like there's no harm in checking, right? So but yeah, like you said, so many people just think, oh, that's not for me.
Yeah. Now, this is not an endorsement, but I have to say that I go to Kaiser,
Mhm,
and every single time when I check in or they ask me, do you need help? Do you need financial assistance?
mhm.
Right from the get go, like when I'm checking in before anything. Um, this is the first time that that I've ever seen that. And I've only been with Kaiser for a little while, but I know that when I was going through other medical groups, that never
Mhm.
came up. Why aren't more hospitals forthright about this? Like, why aren't they just,
Yeah, it's a great question and one that I probably have multiple answers for. One, what state are you in?
I'm in California.
Okay, so California just passed AB 1312. We helped with this. It
Well, then thank you. I
requires
appreciate that.
hospital. It requires hospitals to screen people for charity care before they can bill them. So same thing with Oregon, which was a law that we passed, and then we're working on it. That this would be like our hope and dream would be that $4 doesn't have to exist. It's kind of embarrassing that $4 has to exist. These programs they're already there. The hospitals already have them. Why is there a nonprofit that needs to like help people and enforce them? So we should be trying to shift the burden onto the hospital to screen people for the programs, not to have all the pressure on the patient to like discover them and find out about them and jump through all the hoops. So um, one, I would say that hospitals will say, this is a huge administrative burden. We can't do this. We can't, screen everybody. Um, but they can screen everybody for insurance, right? Like they're going to ask you if you have insurance when you get into the hospital, right? Like, so I think that is kind of mm, I don't know, not a great answer, but we hear that a lot. Oh, it's a huge administrative burden. Uh, Other times we hear hospitals say, what are you talking about? We do the best job ever at charity care. Like, look, we have posters in the ER. We have, you know,
In the
signs
ER
in the
where people
lobby.
are looking for them, right?
Exactly. So it's like they come at it from this like we're doing all that we can.
Yeah.
But it's usually like the minimum because if you look at 501R, it says you have to have a policy and the policy has to be widely publicized and widely available. So, like, that's it. It's pretty vague. So, if a hospital has a poster in the ER, it's widely publicized. Or if a hospital takes out a small ad in the local newspaper, it's widely publicized. So, I think that hospitals just need to think about um, how to better share this information with patients. And I think lastly, there are hospitals and also like there are hospitals that do a great job at this. There are hospitals that do a fantastic job with telling patients about their financial assistance programs. I would say like most more often than not, they don't do a great job. But I think that there is you know, and this is it's tough because there are hospitals that if they can collect, they will. And it's like at the end of the day, they're trying to make money and they're trying to collect. And if they're going to invest in something within their like revenue cycle, they're going to invest in how to get more money, not how to more efficiently give charity care, right? So like when we go and try to talk to hospitals and say, hey, like this is really important, you should be investing in and making these programs better, they're thinking, no, we're going to invest in trying to get more dollars in. So um anyways, I could ramble on and on about that, but it's different answers depending on the hospitals that you talk to.
Um, is there a place we've talked about hospitals a lot and going to hospitals a lot? Is there a place where you're just working with insurance company and not even the hospital that you're going back and forth with, or um,
We do not typically work with insurance. I'm trying to think because if a patient has insurance and let's say they have a $5,000 deductible, the insurance is going to pay their portion.
yep,
The patient has that 5,000 and the patient then is going to come to us to try to get charity care for the
yep,
5,000. So we don't typically, we have insurance companies that refer patients to dollar four, but we're not like working back and forth with insurance.
got it. Um, Now, I know that we talked briefly before about the hospital bills and what we should be looking at. And I know itemization is a big uh, is really a big factor because you don't usually get an itemized bill at the beginning.
Mhm.
You know, I know that several times I've had to request it.
Mhm.
Um, is there anything else that, as a consumer, because we are consumers of this, that I should be looking at on the bill or asking for?
I think that there's a whole other piece to this of like trying to think ahead. And here's the problem: is people because people ask us all the time. They're like, "Oh, could I do this before I go to the doctor?" And it's like, well, yeah, you could, but most people don't have that luxury, right? They're going for an emergency or whatever. But I would say if you do, like if you know that you need a surgery, and it's not something that you had to go to the ER for or whatever, and you're trying to plan your care, you can look up because there you could be there. There are scenarios where you could be in a city, and this hospital 5 miles down the road has a more generous charity care policy than the one that is 2 miles down the road, right? Or whatever. So like you can think about where is going to be best, financially for me. Again, it's a rare thing
Yeah.
that, but we've had people say, yeah, I went to this hospital instead because their charity care program was more generous.
Now, how should someone approach the first call to billing or finance department? I know that you mentioned really briefly about yeah, you know, saying if I pay today, what is the cost? Have you ever talked to people or you yourself when you call a hospital or the billing department where they kind of brush you off, and how do you handle that?
Yeah, so you kind of have to put on that like because I am not normally this person, right? Like I'm but you do have to be, I don't know, the squeaky wheel. You have to be annoying. You have to ask for the supervisor. So you kind of have to get in that mindset. um, you're probably going to wait on hold for 45 minutes. You're going to have to like there's just a lot to it. What I always tell people is that the person on the line that you're talking to, they're probably not having the best time ever, right? Like
Yeah.
be kind. I try to like joke around and I try to be super lighthearted. Like, hey, um, I will tell them the story. Hey, I was shocked when I saw this bill. Like this is a financial burden for me. I'm not really able to pay this. Like, is there anything you can do? Is there a settlement amount? I have this much money that I can pay today. Is that something that you would accept? So I try to be super kind, and here's what I always tell people is that call does not, that is not the call that is going to decide things. I have been told no 3, 4, 5 times. I will call back the next week. Like you are talking, like, think of, these billing departments have hundreds, if not thousands of people that are answering these phones. So if you call one day and say, "Hey, hospital, I can't pay this bill. Would you take this amount?" And they say, "No, sorry, we can't do that." Okay, bye. I will call again next week and I will talk to somebody else. And that has worked. Multiple times has that worked, where it's like somebody else is like, "Yeah, let me get a supervisor to approve it." And again, you have a year. So, like, you don't have to solve it right then and there. The only annoying part is that it's a lot of time, which is, but it can be a lot of savings, to do it. I mean, think of, it's like I probably spent 2 hours on the phone, uh, with that bill for the labs, but it saved me $1,000.
Mm.
So that's pretty darn good,
Now,
right?
in this situation that you just said, where you were going, just call again, just call again. Now, do you find, because all of us see it, and that different people give different answers. Do you find that it's just that, like, people on the other end, they just don't know, or do you find that they're not empowered to make decisions, or they feel not empowered to make decisions? I know I'm asking you to get into the other person's head, right? But I'm just curious.
Yeah, it could be a handful of things. It could be, oh, we just don't do that. We don't do that. Oh, we don't. Yeah, so maybe just like lack of knowledge or whatever, and then, um, maybe you ask for a supervisor, maybe you call back, you talk to somebody else. But like, and I would say very, very rarely will a hospital group that I have, and I've done this, hundreds of times, where they just say, like, we do not negotiate under any circumstance. Like, that is like a rare thing. Um, so I think sometimes it's just like, oh yeah, we don't do that, but they actually do. I think also, like, their job is to collect money. So they're probably trying to collect as much as they can. Other times, I mean, they could just be having a bad day. Like, I don't want to deal with that. Next one, whatever. So um, it is one of those things that it's so frustrating that we even have to do this. Like, let's just call that out.
Yeah.
It's like, oh, we have to be these, like, uh, you know, eh, investigators and uncover all these secrets in our healthcare. It's like, what is going on? But it, like, yeah, I guess it is what it is. And these, like, any of these tips can can be a huge difference for people. And whether it's financial assistance or negotiating a bill or asking for an itemized bill or appealing your insurance decision or any of these things, it's like healthcare is so expensive, and we need to find ways to save on it. And the system is just so exploitative that if they can collect, you know, if it only costs $1,000, but they can collect $5,000, they'll collect $5,000, right? So it's like we gotta educate and equip ourselves with whatever info we can.
Yeah, and we were really, really, I think that this year, with the changes that have happened, are seeing so many people suffer with not
Mhm.
being able to afford health insurance, so getting all these big bills from the hospitals, or not even going in for help. It's really, it should not happen in any country, but especially in a country that has so much money. It's very unfortunate and aggravating.
Yeah, I agree 100%. Yeah, I said earlier, like, it's frustrating that dollar four has to
Yeah,
exist,
yeah.
right? It's like these are programs that have been around for well over a decade, that we have millions and millions of people that go on payment plans or declare bankruptcy for bills that they don't have to pay. Or, like, putting it on a credit card, panicking and putting it on a credit card can be the worst thing, because now it's like you would much rather have hospital debt than credit card debt,
Definitely.
right? At 29% interest or whatever. So it's like, but they pressure you into making that payment right away. So there, that's one of the like big don'ts. Like don't put it on the credit card right away. Don't sign up for their care credit card. Don't do any of that.
Yeah.
there,
And
there are better options.
I think it really is drilled into our brains that you should be paying. You should be, pay off your debt, pay off your debt. I remember when I was younger, hearing my grandfather had a whole bunch of heart surgeries. And my grandmother, I mean, she was so proud when she paid off the hospital debt. It took them 20 years to pay off
Mm.
the hospital debt, but she was so proud. Like, really?
Yeah.
This is, and my grandparents, they weren't wealthy people. I mean, it took them a long time to pay off those debts, but gosh darn it, they weren't going to be freeloaders. They were paying. I think it's really drilled into our brains. This is our society.
Absolutely. I mean, we have, yeah, we there have been time and time again where we have to convince people that like we know that are eligible. We have to convince them to apply for these programs because yeah, it's that idea of, well, I also just think that there's a lot of shame in any type of debt, even if it's a debt like medical debt that you don't choose to take on, right? Like this isn't something that um no one's excited to go to the ER. No one's excited. Like these are things that happen to people. And I tell people all the time, like there's no shame in having medical debt. It's the number one cause of bankruptcy in America. It's the um it is something that pushes people into a cycle of poverty more often than anything else.
Yeah.
1 in 4 Americans don't get the care that they need because of the cost. Uh, it's so. I mean, think about how many GoFundMe's exist trying to pay. It's like everyone knows someone, and what's so funny is that people are so willing to give to those campaigns to help someone else with their hospital bills, but they would not take the help from a charity care program themselves. So it's like it's like break that mindset of, hey, like you're not a freeloader because of this program. Like think I'm like the hospitals are tax exempt. And then they're not going to tell you about the program that earns their tax exempt status. Like who's the freeloader here, right? So anyways, I
Yeah.
could
Yeah.
it's a
I
different
love it.
discussion, but
I love the honesty and the passion. It is exactly what we need. You should be running for office. Um,
Oh
so,
man, I
so,
don't know
so,
about
Jared,
that.
I need to ask, Jared, do they all know, like when you're calling certain hospitals or billing departments, do they know you? I mean, are they like so used now to talking to you?
They don't know me. They know our staff though. Like they are patient advocates. And they, some hospitals, there are hospitals that, are frequent flyers at Dog for because it's like, we submit thousands of applications to think of like the big systems, Ascension,
Mhm.
Providence, so there are billing departments that it's like, hey, it's us again, right?
Yep.
Um, but most of the time, we would love to work with hospitals because the reality is that these programs are difficult and they're difficult for everybody because the hospital and the hospitals could fix their portions, but what ends up happening is that there's one piece that no matter what happens, it's going to be difficult, and it's the proof of income. You have to provide if you're going to apply for financial assistance at a hospital, you have to prove to them that you are within the income range. And how do you do that? You have to 3 months of pay stubs, tax return. And what if you don't have pay stubs? What if you were laid off? What if you had like there's so many different scenarios. So the billing department has to go back and forth and back and forth with the patient. So if $4 can come in and create a better experience for the patient, then the hospitals get fully completed applications that are you can read that aren't faxed in by some patient that didn't have their pay stubs. So like we try our best to make the hospital's job easier. And obviously, like we've had some little fights with hospitals here and there, but like generally we're trying to, like, I'd love to work with more hospitals. I would love for hospitals to just tell patients, hey, go to $4 instead of sending them to a financial counselor in the hospital or their random web address and having them fax their application. I'd love it if hospitals just said, hey, we work with $4.
Yeah.
Go chat with them and they'll help you through this program, because we're better at helping patients at it anyways.
What are the most common reasons why people get denied for charity care? Is it the paperwork that's not fully, not fully filled out? What do you notice?
So a few stand out. One is the federal minimum is 240 days to apply for charity care.
Okay.
So
From getting the bill or from the service, date of service?
getting the bill.
Okay.
Once you get that first bill, the clock starts ticking. You have 240 days. And that's national. Some hospitals go beyond that. Some states like California, I don't even think that they have minimums, but generally speaking, 240 days. So people apply too late. We argue against that a lot, because how is someone going to apply for a program they didn't know existed? So it's like, no, hospital, that's on you. You didn't tell the patient. So we try to fight those. But I would say, too late would be one. The other thing would be sometimes hospitals have additional rules that they will throw into their policies. So, hey, you have insurance. If you have insurance, you're not eligible for charity care. That's rare, but it does happen. I would say residency. So sometimes people, let's say that you're traveling and you have a medical emergency in a different state. Hospital says, hey, you got to live in this state to get our charity care. There are, but I would say, yeah, most often the reason that applications are getting stuck is because of lack of information. It's you uploaded 2 pay stubs and you're supposed to upload 3. Simple stuff like that. You're self-employed and your income, you need to give us all these different documents. We've had applications submit that are 60, 70 pages, of stuff that hospitals require. And, hospitals get wild with some of the stuff.
Well, I think purposefully they make it more difficult.
Yeah, I don't think that the hospital needs to know the make and model of your car,
Yeah.
right? To see if but yeah, they'll ask, or they'll, a big thing that's been argued over is, like asset tests. So should a hospital be able to ask you how much is in your 401k? Should you have to, cash out your retirement to pay a medical bill?
Exactly. That it's ridiculous that you should have to lose everything. The people who work so hard their entire lives, they should have to lose everything in order to pay a hospital bill to be healthy.
Well, yeah, and it's interesting because that argument, like, we always argue like you shouldn't be able to ask those questions.
Yeah, exactly.
And whenever I am talking to hospital leadership, I'm like, well, would you ever require someone to sell their car to pay the hospital bill? And they're like, oh, well, we would never do that. I'm like, then why are you asking? Why are you like, if you like, yeah, it's a weird, it's weird. And there are a handful of hospitals that still do it. That ask about it, but then say like, oh, we wouldn't want you to cash out your, retirement. But it's been a fight. There's a handful of states that are still fighting over that.
So interesting. Now, if someone has already started to pay a bill, can they apply after they start paying the bill?
Absolutely. And not only can they get their bill reduced if they qualify, they will get a refund.
Oh.
If you have been on a payment plan for 6 months and then you discover, oh my gosh, I'm eligible for charity care, that hospital will have to refund you. And then they will apply the discount. So don't let them not refund you. They need to. So there's a lot of things um, like that. Signing up for a payment plan doesn't disqualify you for charity care. Um, Even being in collections. So, like
Mm.
a hospital, most of the time, hospitals will give you 180 days to apply for, or sorry, to before they send you to collections. So, and so it's different. Sometimes it's 90 days, sometimes it's 120, 180 days, whatever. But remember, you have 240 days to apply for charity care. So you can be in collections, but still be eligible for charity care. So a lot of time, and that is totally on purpose. Like, think about it. Most of the time, people see collections and they think game over.
Yep.
Like, there's no negotiating. There's no, and sometimes, well, that I'll say that in a second, but you can absolutely still apply if you're in collections. That is not game over. Um, when it comes, this is kind of random, but when it comes to negotiating medical bills, sometimes you can get better. You can negotiate even better with the collection agency. Um, I made a video on that because I was talking to the provider and I was like, well, what's the best you can do? And they kept giving me this price. And I was like, and they kept saying, well, you got to pay this. Otherwise, we're going to send it to collections. And I was like, well, I'm going to wait for you to send it to collections. And then I'll see what and I was able to negotiate a better rate with the collection agency. And again, as long as it's not as long as it's before the year, it's not going to negatively impact me. I'm just dealing with a different office. So again, I think it's just really intimidating for people because yeah, you get final notice, collections notice, you've been sent to a collector. None of it really matters. You have a year.
Yep. Yeah. Um, Now, if a person gets denied the first time around, or they you fill out the paperwork and they get denied, what are their options at that point? Can they appeal? What can they do?
Yeah. So first, we want to know why. Um, if you were denied because your income is too high and you feel like you have maybe a special circumstance or whatever, this happens all the time. I mean, just think of if you're a family of three and you were at the hospital for childbirth and now you're a family of four, the hospital is going to look at your tax return and think that you're a family of three and they're going to apply the income range for a family of three, but now you're a family of four. So like there's so many of these random scenarios where hospitals might deny you because they don't understand the full picture of the situation. Or, hey, my tax return says that I made all this money, but I got laid off. I don't have that job anymore.
Yep.
Or whatever. Or hey, I'm on workers' comp because I got hurt. Or like there's just a million different things that can happen. So if there are special circumstances, we always encourage patients to fill out like a hardship letter that just explains, like, hey, this might look weird, but this is what's going on. And hospitals are pretty flexible with that. So number one is find out why you got denied and then see if it's worth the appeal. If they say, hey, you make too much money and you think that's wrong, absolutely, you can appeal the decision. You can write the hardship letter. You can explain more, or maybe they need more documentation. If it's something like, hey, we only have charity care programs for people that live in these zip codes and you live in this zip code, or it's some residency restriction or something like that, then it might be worth a little bit. It might be a little bit more work. So I'm doing a terrible job of answering this question. It's kind of like it depends, right? Because it depends
Exactly.
why they denied like. Yes, you can absolutely appeal the decision. It's just like, is it worth it? Because sometimes it's like, oh, well, shoot, I'm just not eligible, right?
Um, if a hospital isn't following its own financial assistance policy, many don't, I'm assuming, what can a person do? What can a patient do?
Oh, that's a tough one because like there are no, who's the charity care police? right? Like this is the IRS that should be doing this, and like they definitely don't care what's going on with charity care. Like we've tried to get their attention many a time to try to hold hospitals accountable. I would say one, you can reach out to Dollar Four. We're pretty good at this.
Mhm.
um, but outside of that, the offices that I have seen take this the most seriously and have gotten pretty involved is attorney general offices in
Mhm.
states. I would reach out to the attorney general. I would file a complaint. I would say, hey, this hospital never, whatever it is, they never told me about the charity care. They're denying me for this, blah, blah, blah. Um, there have been multiple times where attorney general offices have gotten involved. And sometimes even in Washington state, the attorney general ended up suing Providence Hospital System for not giving out charity care, and they had to pay out like $180 million to patients that they were not giving charity care to that they should have been. So,
The last question. Can't believe we're almost at the hour. What are the most practical ways do you think that um, healthcare adjacent people like death doulas or medical advocates, how can we support navigating the medical billing system? How can we help?
it's a great question. I think that what's important is that when people have the capacity to, because like we're all just trying to survive out here with this stuff, especially with medical, and like when you have knowledge, when you have a tip or something that worked for you, share it. Like, I think about a lot of the different creators. Like, there's a woman just earlier this week. She posted a video on her Instagram, and it was like she was sharing, and she's a nurse, and she it was sharing about a patient that wasn't able to, that they were kind of neglecting care that they needed. They went in, they got this big bill, and she shared about Dollar Four. That video got like 8 million views.
Wow.
And the result of that video, just sharing the information, will result in millions and millions of dollars of debt relief for people, because now we have had hundreds and hundreds of applications come in just because of that one video.
Mm.
So, when you have a resource, put in the bank, share it with people, like grab those touch cards. Like we have the touch cards in English and Spanish that have a QR code where people can scan. Like I think, and honestly, most of them are doing this. It's like that is the group that is the most passionate about these resources, that want to share it out. So I'd say, like, keep doing what you're doing. Like you have a podcast, you have, there's so many different examples of people just helping spread the word, because yeah, we know it's tough out there.
Yeah. Well, thank you, Jared. Thank you so much for sharing your time today. It's a gift. And for all the work you're doing at Dollar Four, I really appreciate it. For those listening, how can people learn more about your work? What is your website?
Yeah, so we are at Dollar Four, and it's Dollar Four FOR, dollar4.org. All of our programs are completely free to the patient. You do not have to pay anything. We have eliminated about $150 million in medical debt for people nationwide. So if you have a hospital bill that you are stressing about, check to see if you're eligible. It will, there's no harm in trying, and we would love to help.
Listeners, a medical bill isn't always set in stone. There may be options, and you have the right to ask questions before you assume what you see is what you owe. If you're supporting someone who is ill or nearing the end of life, you don't have to do this alone. Knowing where to turn can change what this experience feels like. Thank you for joining us. If you have any questions, please comment below or reach out to me directly. And if you found this conversation to be helpful, please like, share, comment, and subscribe. This is Traci Arieli from Comforting Closure, wishing you peace and comfort in your journey. Until next time, take care.